Hello, happy Tuesday, everyone. My name's Gina O'Connor. I'm a grant specialist with the Office of Research and Sponsored Programs. To ask a question today, you can utilize the Q&A function at the bottom of your screen or drop a question in the chat. If you prefer, you can also raise your hand to be unmuted if you prefer that. Today, we'll be hearing from Anna Simonson, who is a health sciences and research services librarian at ID Weeks and Wagner Libraries. She received her PhD in history from the Graduate Center and her master's in library and information science from the University of Wisconsin-Madison. Her presentation today is titled Enhancing Research at USD with the NIH's All of Us Researcher Workbench. And with that, I'll invite her to get started.
Thank you. Hello, everybody. Thanks for joining today. And thank you, Gina, for the introduction. My name is Anna Simonson, and I'll be talking today about the NIH's All of Us research program, and in particular, how this data set can be a valuable resource for your research here at USD. So I'm talking about All of Us today because the library recently received funding to promote the program this year. And this includes training for librarians, so we can assist researchers who want to use the data set. At the conclusion of this presentation, I'll tell you about upcoming trainings that the library will be offering. But the URL shown here on the title slide, if you'd like to jot that down, that has information about the program, and we'll also have a calendar of events with information about these workshops coming up. I should point out too at the beginning that this presentation will provide you with information about the Researcher Workbench, which is the name of the cloud-based platform where you can build projects and store and analyze the data you want to use from all of us. But it is not a demo of how to use the Researcher Workbench. So I'll talk about this more later, but in order to show anyone the Workbench, they actually need to be a registered user. So some of the trainings we'll be offering this fall will be for registered users only, while others will be for anyone interested in using the data set, not necessarily at the registered level. So this is an overview of what I'll be talking about today. We'll start with what the program is, its history, mission, and values, and then we'll move on and discuss the participants and data that appear in the data set. After that, we'll look at the different tiers and how to become a registered user of All of Us and what that really means. And then we'll finish with an overview of the benefits and some upcoming trainings that the library will be offering. And at the end, we'll have time for questions. So let's start with the first topic, the program's history, mission, and values. So All of Us grew out of the development of a new approach for disease prevention and treatment called precision medicine. So rather than making recommendations about disease prevention and treatment based on the expected response of, say, the average patient, which has primarily been the model, precision medicine is an innovative approach that takes into account individual differences in patients' genes, environments, et cetera. And this is in order to provide an individualized treatment plan. So in January of 2015, President Obama announced the launch of the Precision Medicine Initiative. And in March of that year, the NIH formed the Precision Medicine Initiative Working Group. And the group concluded its work with this report that provided a framework for setting up the All of Us research program, which then officially launched in 2018. The mission of the program is centered around precision medicine to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us, hence the name. All of Us is trying to accelerate research by providing easy access to a large longitudinal health data set that already has IRB approval and has already been de-identified. So the time that it takes to collect data and receive the necessary permissions is then eliminated when you use the All of Us data set. So this mission is carried out through these three connected focus areas shown here: nurturing partnerships, creating one of the largest biomedical data sets and making it broadly available, and then catalyzing an ecosystem of communities, researchers, and funders. This mission is also upheld by the program's core values. So the program has articulated 8 core values, which are really key to understanding how the program functions. But rather than reading these off to you, I'm going to illustrate the values by providing examples of how they are embedded into the structure of the program. So looking at the first two, that participation is open to all and participants reflect the rich diversity of the United States. So the goal of the program is to collect the health data of over 1 million people living in the United States. No health insurance is required, and you can be healthy or have health issues to participate. There are no restrictions other than that you live in the US. Currently, there are over 780,000 participants, and illustrating that second value, that participants reflect the rich diversity of the US. Currently, about 80% of these participants are from communities that are underrepresented in biomedical research. 45% about our racial and ethnic minorities. So one of the most unique aspects of the data is the rich genomic data that's available. So you can see here that all of us has a more diverse data set than most other genome-wide association studies. For instance, in other studies, the percentage of Black African American or African participants is 1%, but in all of us, this number is about 22%. So even within the white population, which makes up 55% of the genomic data in all of us, 64% of that 55% checked something that indicated they were underrepresented in biomedical research. So this could relate to gender and sexuality, income, disability, and other things. So looking at how the program incorporates the next two core values, that participants are partners and trust will be earned through transparency. A great example of this is how the program has worked with tribal communities to ensure that they are treated as sovereign nations with their own governments and laws. Since before the program officially launched, all of us has made sure that tribes are included in discussions about the data. So the program also encourages research on topics that are important to tribes and then creates materials to educate researchers about tribal views. They also work to partner with tribal organizations that want to be part of the program, and they never share the tribal affiliations of participants or recruit on tribal lands unless a tribe has agreed. So currently, and I get this question quite a bit, but currently tribal information is not included in the data, but all of us is preparing data and samples for inclusion in the near future. So the fifth core value is really critical to the program, so I've singled it out here, which is that participants have access to their information, and this really makes the program quite unique. So one example of this is how the program deals with the genetic information that they collect from participants. So participants can receive the results pertaining to their genetic ancestry and traits, information about medicine and their DNA report, as well as their hereditary disease risk report. So currently, more than 240,000 people enrolled in the program are eligible to receive their genetic results, of which over 70% are underrepresented in biomedical research. Similarly, over 100,000 participants have also completed both surveys on mental health and well-being, which includes topics like suicidal behavior, childhood adversity, as well as adult ADHD and bipolar and panic disorder. Participants are currently eligible to receive a personality trait report at the end when they've completed both surveys. So the last three core values, that data will be easily accessed, that security and privacy are the highest priorities, and that the program will be a catalyst for positive change, can be seen in the different levels of access of the data. So there are three tiers of access, and I'll talk about this a little bit more in a bit, but there's a public tier of access that requires no login or training, where researchers can view aggregate data and search by keyword in what's called the data browser. You can see this is a screenshot of the data browser, and you can see that it has a keyword search function, which allows you to see quite a bit of data, actually. The data browser is a great way to get undergraduate students quickly involved in research because it's easy to incorporate into classes. And actually, a lot of researchers use the public tier for their research because you can see quite a bit. So researchers can also become registered users after completing ethical research training and ensuring that their organization has a DURA in place, which stands for Data Use and Registration Agreement. for either registered or controlled access to the data set. This is a little bit confusing, so I have a visual for it in a little bit, but there are two levels of access for those who register. One of which is called registered access, and one of which is called controlled access. The controlled tier is the highest level of access. You can actually see granular data, and this is the only tier where you can see genomic data. And this is available to you through USD. So USD already has a DURA in place for controlled tier access. So when you register with your USD credentials, you will automatically have controlled access. Only registered users can access the Researcher Workbench, which you can see a screenshot here, where you can build workspaces for different projects and import and analyze data using RStudio, Python, and SAS. Registered access is currently only available to academic, healthcare, and nonprofit organizations. So you're probably wondering now who the participants are and what data you will actually see in the All of Us data set. So let's move on to the next section. So as I said, one of the things that makes All of Us unique and one of its core values is that the diversity of its participants reflects the rich diversity of the US. And here you can see a breakdown of the categories we're referring to. So about 80% of participants selected something that placed them in the underrepresented in biomedical research category. I should point out before we move on that the numbers change rather quickly, and there's a lag time between when the new data shows up in the data snapshots like this. So you may come across snapshots on the website that are slightly different than what appear on these slides. Not drastically different, but. So some of these other categories are also of note. 24% of participants are over the age of 65. 25% have an annual income of less than $25,000. 10% selected an answer that categorizes them as a sexual and gender minority, and 10% indicated that they have a disability. So here's a look at the types of data in the data set. So I mentioned before that the genotype and the survey data, but there are quite a few other types of data. So the numbers here also are lower than the total number of participants because not everyone completes every section, but you can see the data types listed. So there are survey responses, physical measurements, genotyping arrays, electronic health records, whole genome sequences, Fitbit records, including sleep data, which is new, structural variants, and long read sequences. You can see an overview of this data, and you can search through the data again by using the data browser from the website, which is in the bottom right-hand corner there, researchallofus.org. You can also see that some of the top conditions that are studied using this data are cardiovascular disease, hypertension, mental health, cancer, and diabetes. So a lot of researchers are interested in this genomic data, which again, you can only see if you have controlled access, which USD does. As of April 2024, All of Us contains one of the largest sets of whole genome sequences widely available for research. There's also a lot of survey data in the data set. It contains information from 8 different categories, and you can see this in more detail again by using the data browser or what's called the Survey Explorer, which can be found on the website, again, at the bottom of the page, researchallofus.org. So survey data includes basic demographic data, lifestyle data, COVID-19 data, and more. I get a lot of questions about number 6, the social determinants of health data. So I'll just show you quickly a little more in detail about that one. So the survey data on social determinants of health cover multiple topics, including information about discrimination, loneliness, housing, stress, and more. This is a really robust section of the data set with over 117,000 responses. The COVID-19 survey data, referred to as COPE, is also really robust. And you can see here that a large part of the COPE data includes information about mental health, including feeling nervous or anxious or having someone to love and make them feel wanted. A lot of researchers are using this data to find potential associations across a variety of factors. For instance, One ongoing project I saw is exploring mental health and social support among glaucoma patients enrolled in the COPE survey. I saw another one that looks at mental health change during COVID-19 among people living with HIV. And one other one is looking at the effects of visual impairment on depression and anxiety during COVID-19. So moving on to the next section, we'll look at the data tiers more closely and then talk about how you can become a registered researcher. So here's the visual I mentioned earlier. There are 3 tiers of access to the All of Us dataset. There's the public tier. Anybody can go to the website and access the data browser, which we saw earlier. There are also 2 different tiers for registered researchers. So one is called registered and one is controlled. And as I mentioned, USD, you will automatically have access to that controlled data, which is the only one with the genomic data, and also some other things as well. So here's a better look at the differences between registered and controlled and why it is so significant that USD has that controlled access. So there's numerous categories only available for researchers in the controlled tier. So this includes the entire COPE survey, unshifted event dates, more specific race and ethnicity data, 3-digit zip code data, and more. So more and more researchers are using the All of Us dataset through these registered tiers. So you can see here that the number of registered users grew 107% over 2023. The number of active projects grew 146%, and the number of publications that use the All of Us data grew 224% over 2023. These numbers that are seen in green from December of 2023 are actually low. So just this month, the program celebrated over 10,000 registered researchers who are using the All of Us data. So as I mentioned, the publications are growing too. Right now, there are more than 380 publications using All of Us and more than 10,000 active projects. You can view the active projects from the program webpage that I mentioned earlier, researchallofus.org. But you can see here some of the topics that researchers have published on, and they're really varied. Hearing loss and socio-demographic barriers to healthcare using the All of Us Researcher Program. Another one on here is titled Quantifying Physical Activity Needed to Mitigate Genetic Risk for Obesity. They really are quite widespread. So who exactly is registering to use the data? Over 700 institutions right now from numerous fields are using the All of Us dataset. So biostatisticians, epidemiologists, geneticists, health equity researchers, but really it could be fruitful for numerous fields and people here at USD. It would be a very useful data set for psychology, education, even BCom business students who are interested in hospital administration could find relevant data here on hospital admissions or the average length of hospital stays for different conditions, which are in the electronic health records. So to become a registered user, there are 6 steps, but really there are 4 steps for you because steps 1 and 2 are already completed. You're learning now about the data that's available, and you know that USD has that DURA in place. So you can start with step 3. So you register with basic information. You'll put in your name, your email address, and so on. And then you have to verify your identity by uploading a driver's license or other official form of ID there. So registering for controlled access is how I found out that my driver's license was expired. So you might also find out something interesting when you do that. Step number 5, then you'll need to complete the responsible conduct of research training, which is very similar to city training. You'll do 2 short tests or assessments, and then you will sign the data user code of conduct. And once you sign that, you are good to go. The QR code here will take you to that registration page. So once you finish the training, it's valid for 1 year. The program uses a passport model of access. So it's not a project by project or question by question thing. You can create as many workspaces as you want, and you can work collaboratively with other registered researchers. So you can create workspaces immediately after signing the code of conduct. And when you set the workspace up, some of that information you're asked to enter will be public facing, so people can see what research is in progress. To ensure that your data complies with the program's data use policies, I would recommend requesting feedback when you set up this workspace. So one of the last questions that you'll see asks if you want to have the program's resource access board review your project, which I always recommend and say is a good idea because it adds a level of protection to your project and ensures that you're in compliance with their program. So conclusions and upcoming trainings. I thought it might be helpful to conclude by looking at how the All of Us program staff outlines the benefits for both individuals and institutions of using the dataset. So first of all, they note that it removes barriers to data access that typically exist for early career researchers and students. The Researcher Workbench in particular is a data set that can be used by people who do not have access to other data sets. The cloud-based platform and data browser allow you to conduct rapid hypothesis-driven research, and it's mostly free. So I want to point out that there are computational costs, but the program starts everyone off with a $300 credit. So it decreases very, very slowly from the time for the time that you're using the workbench. And when you're not working in your workspace, you can pause that charge. So the program also notes possible institutional benefits that they're hoping to achieve. It can ensure that data-driven research continues to be a priority for academic institutions. And ideally, use of the workbench has the potential to increase the research capacity, publication rates, grant awards, and research activity at USD. So they also even suggest that the previous two benefits could potentially lead to a higher research designation for USD. So more information about these upcoming trainings will be coming out this summer, but we're planning to offer 2 trainings a month starting in September. One will be specific to the All of Us data and the Researcher Workbench. And then another one will be specific to the tools that you use in the workbench. And those will be longer trainings. That website down in the bottom right-hand corner, which was also on the title slide page, that will have an events calendar, and you'll be able to register for the workshops there. So again, more information will be coming out this summer about the specific dates and times of these particular workshops. But in the meantime, if you start using the Researcher Workbench, you become a registered user, or you just are using the public tier and want to use the data browser, we are available for questions and consultations. So that is the end of my presentation. I'm open for questions now, and I can probably stop screen sharing here.
Yes, thank you, Anna. We definitely have some interest here. First question, have USD researchers started to access this database yet?
So I know of and I haven't checked in a while, but I know of only 2. One person actually did publish an article using this data, but several medical residents are starting to become interested in this and have become registered users. So I know there's just a growing interest, and part of that is we're just kind of getting out into the community and talking about it now. So I suspect that more and more people will be using it.
And I noticed in one of your last slides, it did explain that students are eligible to use the database.
Yep.
Does the process for how a student would access the database different from how a faculty would do so?
No. So they're going to have to take those trainings. There's the 2 trainings. And it takes I would say about 3 to 4 hours to complete the 2 trainings. You read a lot of slides, but they're very concerned about unintentionally creating stigma. And so the second training in particular is quite specific to the data set and avoiding those issues. So everyone takes the same training. Using your USD email, you'll get the same access. But one of the program staff members did mention to me the other day that a lot of people are using just the data browser, that public tier, for undergraduate students because it's a little, it's not so overwhelming because this is a huge data set. So that, has those nice squares and very concrete data and numbers. And you can, when you click on those in the data browser, you can see more data visualizations and more specific details about each one.
Okay. Are there any data sets from this database that have been created for use in educational settings, such as in statistics classes?
That's a great question. Not that I know of, but I will ask the program staff about that because that would be very useful. And I will let Gina know what I find out and she can pass that information along.
Definitely. And now I'm going to go to our webinar chat. Question here. Do we have access to statisticians at USD that can help us with data analysis?
So that is another great question. So I mentioned earlier that part of this award is helping train librarians in the various things that you'll need, the various skills that you'll need to use the data set. And one of our librarians, David Washura, and I can give Gina also his contact information, but he is helping people with the statistics, and he's also very good with R and Python, and he's able to do those analyses with you. So yes, I would answer that as, it's a first come, first serve. We have one person who's available to help with statistical support though.
Okay, excellent. Another viewer is commenting, can you please repeat the piece regarding costs involved following registration?
Yep. So when you register and you click on the workbench to create your workspace, you'll see that there's a $300 credit that you have. This is given to you by the program staff, and really it's a very, very slow decrease in it's like a fraction of a percent, every hour. And so it goes down very slowly. David, the same librarian I was talking about earlier, has tested this and created some workspaces as tests. And I mean, he didn't even go below, I don't even think he's below $297, and he's been on there for quite a while. So I can't tell you the exact hour time, but yeah, there is that charge because you're storing data in this cloud-based platform. But I would think that the $300 will get you quite a long ways.
Okay. Can you share with us the link for publication related to this data bank?
For like the publications that have come out that use the All of Us data?
That's how I read it. Yes.
Okay, so on their website, researchalofus.org, when you go on there and they have a few drop-down menus. There's one that's about, it's either Discover or Discovery. And under that, you can see both publications that have come out and also, the USD Researcher, I see that from Mark. Publications that have come out, but also ongoing projects. So the research that USD Researcher published using the data, I can share that, that article. I do have that.
Okay. Yep, I can include that in the email I send out tomorrow.
Yep.
Another question here, can Stata be used for analysis?
Not right now in the Researcher Workbench. So right now it's limited to RStudio, Python, and SAS. They are always updating this based on, so they use Jupyter notebooks once you create your workspace. They are always updating this and adding it based on, feedback that they get. So that might be something that they'll be adding in the near future. But right now it's just the three.
Well, we've definitely had some interest here, Anna, with this new opportunity. thank you so much for your time and for everyone for joining us. You will receive an email tomorrow with the slides and the recording and contact information if you have more questions. And with that, I'll let everyone get on with your day. Thank you so much for joining us.